mydentist.com, and today I'll be explaining to you what bruxism is, what it affects in the oral cavity, and what the treatments are for bruxism. Bruxism is a habit, mostly, that patients form when they are unconscious, usually in adults, but also in children. A lot of times children have wear on the incisive and the occlusal edges of their teeth due to bruxism at night when they're sleeping. As bruxism is an unconscious habit, a lot of people don't know that they do it unless they do it so severely that they wake themselves up at night. And that only occurs in a few cases, but for the most part, bruxism goes unnoticed unless it's clinically detected by an oral health professional. Bruxism affects a lot of things. It affects the enamel surfaces of the teeth, which help keep the teeth healthy and strong. It wears those down until the dentin is exposed, at which point there's a lot of sensitivity with dentin exposure to hot, cold, and pain. Another thing that bruxism does is affect the temporomandibular joint, which connects the mandible to the rest of the skull and allows you to open and close and deviate your mandible from side to side when chewing. Temporomandibular joint disorder can be extremely painful. It depends on the severity, but this disorder impacts speech, mastication, which is chewing, and a lot of other things. It's very painful when you can't open and close your mouth. So bruxism is very detrimental in that aspect. Another thing that bruxism does is wear down restorative work. If you have crowns and bridges and fillings on your teeth, if you brux at night, what will happen is those will become cracked and loose a lot more efficiently than they would in a patient that does not brux. Now, bruxism is very common. Somewhere around 98% of the population grinds their teeth at night, so it's a very common thing, and for that reason there are a lot of ways to treat bruxism and to help it and to stop it. One thing, and probably the best method for treating bruxism, is to have an impression taken in a dentist's office and then to have a customized night mouth guard made for bruxism. Bruxism can be treated with this mouth guard because it provides a safe and tight coating around the teeth at night so that if you do clench or grind your teeth, it won't affect the enamel surfaces or restorative work, because that shearing force will literally be on top of a mouth guard as opposed to just on the tooth surfaces. And you see with this type it on, when you clench and grind your teeth, that can have a lot of impact. Another thing that you can do if a night mouth guard in a dental office is too costly is to make one. A lot of drugstores and pharmacies and even stores like Target, Walmart will have kits that you can buy. You boil your own mouth guard. It's a standardized piece of plastic material, and then you fit it yourself. So this is a helpful way to treat bruxism that doesn't involve going to a dental office necessarily. Another thing that you can do is consult with a physician and talk about other treatments for bruxism. But the standard of care right now for this habit is to have a mouth guard made or to make a mouth guard, and that seems to be most effective. Thank you. I'm Lauren for FindMyDentist.com, and this has been a small discussion on bruxism.